Hello, everyone, and welcome to today's webinar, Managing Our Fears and Stress, Strategies to Cultivate Emotional Agility. I'm Stephanie Adler-Yuan. I'm Director of Education and Training here at the Schwartz Center for Compassionate Healthcare, and I'll be your moderator for today's session. We're so grateful that you were able to take the time out to join us today, this morning, on this beautiful morning. This Compassion in Action webinar is a program of the Schwartz Center for Compassionate Healthcare. We're a Boston-based nonprofit organization that was established in 1995. Many of you, I hope, are familiar with our flagship program, the Schwartz Rounds, which is offered in hundreds of our member organizations around the world and provides caregivers from all healthcare professions a forum for discussing the complex emotional experiences of caregiving. So we're going to get started. Before we do, there are a couple things I'd like to note about today's session. First of all, this special series of COVID-19 focused Compassion in Action webinars, which we've been running pretty much weekly for the last 2 months, has been supported by the Coveris Community Healthcare Foundation and by a donation in memory of Julian and Eunice Cohen. We are so grateful for their support. Today's program is going to last about an hour. So we'll have a presentation, a conversation actually, for the first 45 minutes, and then you'll have a chance to ask questions using the questions pane on your GoToWebinar control panel. Please note that everyone's listening and everyone participating is in listen-only mode, and this is computer-only audio, so there's no dial-in number for today's session, but we do encourage you to interact with our speakers using that questions pane, and we hope you will. So the last thing I'd like to say is that we really appreciate your feedback, and we'll have a very brief survey at the end of today's session. We'd really appreciate you taking just a minute to fill it out and let us know what you thought and what you took away from today's conversation. So that is it for my notes, and we'd love to get started. It is my pleasure to introduce my dear colleague and our host for today's session. Dr. Beth Lamb is Chief Medical Officer here at the Schwartz Center for Compassionate Healthcare, and she's Associate Professor of Medicine at Harvard Medical School. Welcome, Beth.
Thank you, Stephanie, and good morning, everyone. I'm just really so happy to have Susan David join us this morning. Dr. David is a psychologist on faculty here at Harvard Medical School, and she is the author of the best-selling book, Emotional Agility. That's also the title of her very impactful TED Talk, which has seen more than 6 million views. She's a frequent contributor to the Harvard Business Review, the New York Times, Washington Post, Wall Street Journal. She's been a guest on national radio and television, among many other things. And we're just delighted and thrilled to have you with us here today. We are going to have a conversation. So let's go ahead and see if we can share our webcams, Susan.
Hi.
Let's see if I can get mine on as well. There we go. Welcome. So good to see you.
I'm delighted to be with you.
Thank you. So let's dive in. I'd love to hear you say a little bit more about yourself and how did you become interested in this concept of emotional agility?
Well, you mentioned a little bit earlier my TED Talk, and firstly, I'm so grateful to be here with you and with the people who are listening right now. I know that so many people, if not everyone, is just going through something that at the beginning of the year, none of us could have expected or predicted. Some did, of course. But I don't think we really were able to internalize the impact that this might have. And, it really connects with your question, which is, what is it that drew me to be interested in these ideas? So I grew up in apartheid South Africa. I was a white South African, essentially growing up in a country that was committed to denial. To not seeing the other, to really, it was at a fundamental level denial, not seeing other people's pain. And when I was around 15 years old, my father was diagnosed with terminal cancer. And I recall my mother coming to me one Friday and saying to me to go and say goodbye to my father, because we knew that this was the end for him. And I recall, walking through my home down the passage to where the heartbeat of our home, my father lay dying. And I recall to this day that his eyes were closed, but he knew that I was there. And I'd always had this experience from him, which is that I always felt seen. I always felt that even when I was going through difficulty, I felt seen. And I kissed him goodbye. I told him I loved him, and I went off to school. And then I had this experience that I think so many of us are experiencing right now, which is, for me, I went back to school on the Monday, even though my father had died just 2 days earlier. And the reason that I did that was because my mother felt that it would be helpful for us to, keep into a sense of routine as much as possible. And I recall, going to school and May, which is when my father died, actually, his anniversary was this past weekend, which also happened to be the birth date of my daughter. And I recall really this experience of going from May to July to September to November, going about with my usual smile. People would ask me how I was doing, and I would say to them, I'm okay. We so many of us become the masters of being okay. But in truth, I was struggling. My father had died. My mother was grieving the love of her life. She was raising 3 children, and the creditors were knocking. My father hadn't been able to keep his small business going during his illness. And so we were struggling as a family. And yet I was doing this whole thing of like, I'm okay. I didn't drop a single grade. But I started to, as a young girl, experience difficulty because, as we know, as human beings, internal pain always comes out. It always, and the people who pay the price are our families, our communities, and of course, ourselves. And so for me, that took the form, as so many young girls do. I was 15, refusing to accept the full weight of my grief. And I started to use food to numb my pain, binging and purging. And so, that's probably a different answer to the answer that I could have given, which is, I'm interested in these things academically. Yes, I am. But if I really think back to what it was that grounded my interest in the core question of my work, which is this guiding question has been very simple. What does it take internally in the way we deal with our thoughts, our emotions, and our stories that help us to live in a complex and fragile world? Because ultimately how we deal with our inner worlds drives everything. It drives how we love, how we come to our relationships, how we live, how we parent, how we lead, and how we are ultimately able to connect with our patients and with the people that we serve. And my work is really born from that very early experience of trying to navigate unsuccessfully my difficulties when I was going through a situation where I wasn't actually showing up to them. And I'll just add to that because I think it's pertinent to where we add in this conversation, which is that I had this amazing English teacher. And I recall this teacher a couple of months after my father had died, and she handed out these blank notebooks to the class. And this invitation was this. She said, write, tell the truth, write like no one is reading. And through this journal, I was invited to show up for the first time authentically to my grief and my pain. And it was such a simple act, the simple act of basically writing in a journal. But for me, it was, as so many simple acts are, it was a revolution. And it was the revolution that started to shape my entire life and my career. And I became interested in these ideas, which is partly driven by, what does the society tell us is germane and important to our well-being? And society often tells us that, like, we've got to just be positive or think positive. There's this narrative of happiness, of gritting, of just getting on with things. And actually, what we know when we look at the reality of human well-being is that human well-being is not born out of grit, and human well-being is not born out of denial or false happiness. It's born out of showing up to ourselves and using strategies and connecting with our own pain. And it's from our own connection that we are then able to become better resourced and bring ourselves more fully to the world. So that's probably, I don't know if that's the question or the answer you were expecting, but really that is the truth for me of what shaped my learning and my interest.
Yeah, thank you, Susan. Well, first of all, I just want to say that I'm sorry that we're having this conversation so close to the anniversary of your father's death. And thank you for showing up for us here today.
I'm grateful to be here.
You mentioned this notion of bottling up our emotions, and so many people are experiencing very, very complicated emotions right now. There's pride in what we've been able to do. There's a sense of camaraderie. There's also a very deep sense of grief and loss and pain. And yet, to keep going, we have to put those aside to some extent. They can't sit there forever. But just in order to keep on functioning, we have to compartmentalize. And I'm just wondering, how do we strike that balance between acknowledging our emotions, not bottling them up indefinitely, but just persevering in our everyday work? So I wondered if you could just talk about that a little bit.
Yeah, absolutely. It's a really, really important question. What I found in my work is that often when people are dealing with difficult emotions, they do one of two things with those difficult emotions. Often people do bottle. And what do I mean by bottle? It's compartmentalizing, it's pushing aside. But there are other ways that we can bottle. So for instance, we could say things like, well, I've got it easy relative to most people, therefore I shouldn't feel what I'm feeling. I should just be grateful. Another way we can bottle is by trying to push aside the difficult emotions in the service of this forced happiness. Like, I've just got to think positive. So there are different ways that we can bottle emotions, and that in particular, as I mentioned earlier, becomes perpetuated by society. I don't know why I keep stumbling on that word, but by a society where everywhere we go, almost on social media, people talk about, get rid of toxic people, think positive. There's so much of this narrative which is about really chasing happiness. And what is bottling? Bottling is basically moving into a space of internal struggle with ourselves, where we have an emotional experience, but for some reason we think that that emotional experience shouldn't be there now, or that we can't afford to have it there now. Now, of course, I'm married to a doctor. I'm married to someone who works at the MGH, and I know full well from our own experience at home, this thing where, often you've just got to get through the day. You're trying to homeschool your children, and you've just got to get through the day. So there's nothing wrong with moving into a space where you're doing occasional compartmentalizing. You're going into work and you are grounding yourself and you are readying yourself to face the day. And in order to do that, you sometimes need to kind of just push whatever it is aside. But what's really important to recognize is that when we do this day in and day out, that it is a recipe for burnout. If physicians and healthcare workers and individuals on the front lines of delivering to patients were not experiencing burnout before COVID-19, we know that now this is probably the largest crisis that is going to be faced in medicine at large, writ large today. So, you know, there's nothing wrong with occasional bottling, with occasional pushing aside. But what I think we need to recognize is that it is a recipe for burnout, that when it becomes our default way of coping, and we're now going into, you know, almost 2 months of this, or 2+ months of this, and for many people listening, even longer than that, then there's burnout. So how do we deal with that? You might think that, well, then what I need to do is the opposite. Instead of bottling my emotions, I need to think about them and feel them and stay with them and stick with them. What I call that then brooding. You know, often what happens is we can push aside difficult emotions, but the opposite, and people can often go from one to the other, is we can get really stuck in our difficult emotions. We feel them, they drive us, and they start to own us. So, you know, an example of what this might look like is it might be that feeling of like, this is terrible. I feel so stressed. I just, you know, can't. I'm depressed. Our emotions start to own us and we start getting stuck in them. So really, you know, both of these ways of being, both bottling and brooding, look very different. But when you actually look at the psychological and mental health toll of them, they're actually similar in terms of their outcomes, which is that bottling and brooding are both associated with lower levels of well-being, depression, anxiety, stress, burnout. But also, you know, they're fascinating studies looking at in organizational contexts where you've got a leader who's bottling and pushing aside and who keeps saying to staff, you know, we've got this, let's not think about the difficulty, we'll just, you know, go through it and we'll get through it. And what's really interesting is studies that even show that when a leader is bottling, even though the team don't know that the leader is bottling, that the team's blood pressure actually increases. And there's fascinating research showing that there's almost this emotional contagion that starts to happen in these environments. So of course it then, and everyone who's listening is saying, okay, well, what do I do? You know, if I can't bottle and I can't brood, but I'm stuck in going through the reality of my day, which is really tough, what do I need to do? And we can explore some of these, but I think one of the first things that is really important is to recognize that restoration happens in the moment of the pause. So restoration happens in the moment of the pause. And so we need to gift ourselves. We need to gift ourselves that pause. And what do I mean here? If you're coming home from work and you are in an Uber or gloved up and masked up on public transport, this is now your pause. And instead of using that to go on social media or to, you know, vent to someone, it's really important to be intentional about thinking about how you can create that pause. And pauses don't need to be big and they don't need to be sophisticated. In fact, they can't be big and they can't be sophisticated for many of us right now. A pause might be a piece of music that's beautiful and that reminds you of humanity and the bigger picture, and it's something that you choose that connects you with you. A pause might be breathing into yourself. A pause might be simply talking to yourself in the third person, which might sound odd, but we know that when people get stuck in difficult emotions, perspective taking is really critical. So when you're going through a tough experience, just saying to yourself, Susan, this is tough. Susan, you've had a really tough day. This is being compassionate to yourself. A pause is taking a bath and being with yourself. A pause is also the pause that happens when, as so many of us are experiencing right now. I just started to do a podcast with Ted, which is a COVID coping podcast on how do we cope with our emotions during this time. And it's been running for a number of weeks. And what we're finding is that this, for many people, is the moment of, I just can't go on. You know, many people are hitting a wall right now. So, you know, what is going on is, for so many of us, Monday has become the same as Wednesday, has become the same as Sunday. The morning is the same as the evening. Work is the same as home in many different ways. And so sometimes that pause is actually about demarcation. It's about saying, it's 7 p.m. I could do email, but now my pause is about being with my children. It's about dinner. It's about presence. And it's about having a picnic on the lounge floor, or doing whatever it is that reminds us of us, as opposed to, you know, the being part of us as opposed to the doing.
You know, it's so helpful. And by the way, we'll have to send people the links to your podcast, because I think for sure people are going to be interested in it. You know, it's interesting you mentioned this concept of the pause, because I know you very much admire Viktor Frankl's work, and he talks about that pause, that space. It's not so much a pause as a space between a feeling and a reaction. Can you talk about why he's been important to your thinking? And certainly he's been important to mine, I know that, but I'd love to hear you talk some about that as well.
So yes, and let me step back and then come into that, which is, all of us are experiencing many different emotions right now and many different thoughts. And there is nothing, you know, I mentioned earlier that I don't kind of buy into what I call the tyranny of positivity. You know, the tyranny of positivity is this idea that people with cancer are automatically told, very often by family members and by loved ones, you know, just stay positive. The tyranny of positivity is the idea that when people are being marginalized and discriminated against, they are messaged to stop being so angry. You know, the tyranny of positivity is the idea that we somehow have good emotions and bad emotions, and that the good emotions are the happiness and joy, and that the bad emotions are everything else, the anxiety, the grief, the sadness, the loss, the loneliness, and those are bad emotions. And again, that is what's telegraphed by society. And, you know, when we as a collective, when we, everyone on this webinar, step back, you know, we know that our emotions and our thinking evolved to help us to survive and adapt. So if we're experiencing grief or negativity or stress or judgmental orientation or criticism, these so-called negative things, that is our brain and our psychology and our emotional adaptive system doing its job, and, you know, which is to protect us under threat. And if there was ever a time when we are in the shadow of illness, death, and uncertainty, where we might be experiencing these so-called difficult emotions, it is now. Like, these experiences are normal. So what becomes really important then is to step back and to start saying, okay, if our emotions are not good or bad, but they just are, they're part of our adaptive signaling system, at what point does it become where I'm being with my emotions, but I'm getting stuck in them, or when it's they're now no longer effective because now I'm depressed. And a helpful way to think about this is using this Viktor Frankl idea, which is that when we are on autopilot, when there's no space between stimulus and response, when we are acting in ways that are taking us away from being the person, the loved one, the colleague that we most want to be, then we are being inagile. So what did Viktor Frankl? Viktor Frankl survived the Nazi death camps. And he spoke to, I think, what is one of the most powerful ideas ever articulated in human history.
Yes.
Between stimulus and response, there is a space. And in that space is our power to choose. And in that choice lies our growth and our freedom. When we are hooked by our emotions and thoughts, when we've moved away from, gee, these are data, into, oh my goodness, this is fact, and we're being driven by them, we are hooked. There's no space between stimulus and response. So examples of being hooked are, you know, my husband's starting in on the finances, I'm going to leave the room. You can see you feeling an emotion and you automatically reacting to that emotion based on what you're feeling. My voice isn't heard at the hospital, so I'm just going to shut up. Okay, we're feeling something and we're just reacting, and therefore we shut ourselves down. I'm having the feeling that I'm, you know, I feel guilty right now. I feel guilty as a parent because I feel like I'm not being a good parent in the midst of all of this. And we start buying into this feeling and we treat it as fact. Oh my goodness, this means I'm a terrible parent. It's awful. You know, I'm bad. Again, there's no space between stimulus and response. So what becomes definitional of emotional inagility is when there's no space for other parts of ourselves. Our thoughts and our emotions are owning us rather than we owning them. Because of course, you know, our thoughts and our emotions are helpful, but they're not all of us. You know, we've got other parts of us that we can bring to any interaction that we have. All of us have got courage. We've got wisdom. We've got our values, who we want to be in the world, how we want to lead, how we want to connect. And when so much feels out of our control, we can so often move into a space of just being reactive. And what is most powerful is when we start recognizing that our thoughts and emotions are starting to own us, and there's no space between stimulus and response. And so what emotional agility is that starting to use skills that help us to develop some of that space between stimulus and response so that we can bring other parts of ourselves forward, our values, our intentionality, our breathing, our centeredness, and our wisdom. And these are things that all of us have inside of us. And when things are difficult, it sometimes takes the pause to re-access those parts of ourselves so that we can be regenerated and be able to move forward in a way that feels more intentional.
Yes, and I mean, I think that's the linkage between what you were talking about before, that you have to be, I guess, you know, it requires some self-awareness to recognize when you are reacting instead of enabling yourself to take that time to be compassionate with yourself, to pause, to do whatever needs to be done to restore yourself so that you can then step back and respond rather than react to any given situation.
Yes. And so then, of course, you know, it bears the question then, well, how? You know, what are the pathways? What are the pathways to this? How do we start? How do we move into a space where instead of bottling our emotions, instead of brooding our emotions, we are able to show up to them but we're showing up to them in a way that is healthy, where instead of being in struggle with ourselves, where we are breathing into the emotion, but also expanding, what it is and who we are. And I think this is really powerful. We so often in our work as individuals in healthcare settings, we talk about compassion. We talk about compassion, and yet in my experience in working with people who are often, on the front lines, or even not on the front lines, people who are in the space of healthcare, is we will extend compassion to others, but we don't extend that same compassion to ourselves.
Mm-hmm.
We tend to be high achievers. We we want things to be right. We want to have the answers. We myself included, we have an erring to perfectionism. And so sometimes what happens is this idea of self-compassion becomes equated in a synonymous way, but in a way that is a myth. It becomes equated with being weak or being lazy, not being honest with yourself, letting yourself off the hook. And nothing could be further from the truth. When we are compassionate with ourselves, what we're doing is, some people on the call will have heard of psychological safety, where psychological safety enables people to be more effective in the workplace because you're creating a space where people can bring their emotional truth to the work. And when they're bringing their emotional truth to the work, that also means that they can talk about potential failures or medical errors, and therefore there's the opportunity for the hospital to correct. And so there's been a lot of discussion about why psychological safety is so important in healthcare. But think about psychological safety turned in on the self. It is really about saying, I'm safe, I love myself, I care about myself, I've got my own back. If a friend came to me and said, oh my goodness, I cannot go another step, I am exhausted, I can't do this anymore, would you turn on your friend and say, don't be weak, just get through it, just keep going, it's going to be over one day, just ignore? No, you wouldn't. You wouldn't. You would take your friend, you would, at a social safe distance with your mask on and wearing your PPE, you would hug them, you would love them, you would touch them, you would stroke them, you would help them. And so why can't we give the same to ourselves? So when we think about our emotions, when you're feeling a difficult emotion, this is not the space for self-criticism or for comparative suffering. I shouldn't be suffering because so many of my patients are suffering more. This is the time for opening ourselves up and saying, I feel sad because this is tough. This is tough. And even touching yourself, even putting your heart and your hand together in the way that I'm doing right now is really powerful, because it's starting to activate the physiological sense of touch that so many of us find so helpful and that is missing from us right now.
Yeah.
So I think that's one way. Another way, and I can maybe, if it's helpful, I can share a little graphic that might just help with, some of this. Let me just, do this, which is, let's see if this is coming.
There we go. Yeah, I can see it. Yeah.
So, I've spoken about self-compassion, but another part of, and this is just a quick heuristic that I put together, because what I'm finding is that people are in different stages of where things are at for themselves. And I'll leave this up very briefly. I didn't, my intention with sharing it is not to go through it step by step, but I'm happy to share it. another part of being able to move into the space of being effective with ourselves is what I call gentle acceptance. You know, what do I mean by gentle acceptance? Gentle acceptance is this idea that it is what it is. It is what it is. We didn't invite this. We didn't ask for it. We didn't plan for it. But it is what it is. And what I'm experiencing is that our suffering right now is directly proportional to a lack of gentle acceptance. In other words, our suffering right now is directly proportional to trying to control things that cannot be controlled. And so how can I describe what I mean by gentle acceptance? Imagine you're outside and it's raining. And you go, gee, it's raining. That's gentle acceptance. A lack of gentle acceptance is when you say, gee, it's raining right now, and I wish it weren't raining. Why does it always rain when I don't want it to rain? Why can I never catch up on the things that I need to do because all this rain keeps on? So this is now not gentle acceptance. What you're doing is you're in the space of arguing with reality. And we can argue with reality as much as we want, but it is reality. And this applies both to the reality of the external circumstances, but also the reality of our internal circumstances. We can only start to change as human beings when we stop criticizing ourselves, when we say, gee, this is something that I'm suffering with. We can only start to evoke a sense of rebuilding when we stop bombarding the city. And often the bombardment, metaphorically, is when we're bombarding ourselves with how we should be or could be, or why things aren't the way that they could be. So gentle acceptance is profoundly important. There are other aspects of that we can talk about. I'm going to move off from the slide because I think it's really, important to just have a, face-to-face. But one of the things we can also talk about is maybe how to develop some of the skills that I spoke about earlier, which is how do we show up to our difficult emotions, but not have them own us so that we can bring other parts of ourselves forward. And, that might be something that's worth exploring just in terms of like, what are some simple strategies that can be helpful to people?
I think that'd be really, really useful if you want us to offer some suggestions about that. I mean, there's so many different kinds of distress that people are dealing with. And the different, there's so much grief and loss at the magnitude of what people have seen and experienced. There's also empathic distress, which I know you're interested in, and it's when we just become completely empathically overwhelmed with the suffering of other people. And that's why we're good at what we do. It's what brought us to the work in the first place, but it's just so hard. And then there's one more thing that I do want to ask you about, and that is this issue of moral distress, when people are feeling they haven't been able to do as much as they wanted to do. They couldn't save that person. They, lost so many beautiful lives to this pandemic. And that feels like a devastating failure. How to accept those kinds of emotions and integrate them, move beyond them. Is it possible to do that? How do we do that?
So, I think it's such a powerful question, and this conversation is really profoundly important, because really what we are doing is we are stepping into the reality, which is not just cognitive, it's actually a kind of heart reality. And I think so many of us have been going through it in our minds, but it's that heart reality of like, this is hard. Like this is hard. And you know, all the people who talk about, you know, the stages of grief, that there's like this stage and then there's that stage and then there's that stage. As anyone who's ever gone through grief before knows, grief is raw and it's real and it's unpredictable. And it is defined by that. You know, it's defined by the fact that you can be walking about your day and suddenly are like, oh my goodness, like, you know, grief is defined by its unpredictability. And so, you know, there's no way over grief. You know, what grief actually demands of us is that we step into it and that we be with it. You know, there is no getting over grief. There's only being changed by grief and walking our lives with grief. And I think it's really important for us who are grieving in whatever way that is, whether it's grieving an individual, a loved one, a patient, or even grieving the world that was, because that is its own grief. We are changed by grief. You know, we know that when people go through incredible life stress, that there is that. And then we also know that people describe how there's this experience of growth that often comes from that, this experience of learning and reprioritization and reconnection. So, you know, I just want to acknowledge that, because I think, you know, as I talk about some strategies that can be helpful, these strategies are incredibly helpful, but at the same time, let's give space to the fact that for many, this will be a changing experience. And I think that's powerful to look into. So I mentioned earlier this idea that when we are in agile, our emotions are owning us. And what's more powerful is for us to be in a space where we own our emotions, okay? Where we're noticing our emotions, we're not avoiding them, we're noticing them, but we're not being driven by them. So how do we do that? In my work on emotional agility, I talk about firstly showing up to our difficult emotions in the way that I've described, in a way that's compassionate with ourselves. Secondly is to recognize that our emotions are signposts of the things that we care about. So when we experience difficult emotions, again, especially in a culture that tells us we shouldn't have them, we get tempted to just push aside or get over them in some way. What I want to suggest is the opposite, that we don't feel strong emotions about stuff that we don't care about. So your emotions, if you imagine writing on a piece of paper what you're feeling right now, sorry, itchy nose. If you write on one side of a piece of paper what you're feeling right now, and you imagine what that word would be, and every person who's listening right now has that word on that piece of paper: grief, anxiety, loss, loneliness. You can be lonely in a crowd. You can be lonely. It doesn't matter how busy your day is. You can be lonely, because loneliness is defined by lack of meaningful connection, and you can be lacking that meaningful connection. So if you write on that piece of paper what that emotion is, and you turn over that piece of paper and you ask yourself, what are the values that this emotion is pointing to? What is being signposted by these difficult emotions? Grief is often signposting that it's love that's looking for its home. You know, that's what grief is. Grief is love looking for its home. And so when we open ourselves up then to the memories of the person, the connection, we take out a photograph album and we allow ourselves to be in that space, we are reconnecting with that love. Loneliness is often a signpost that you are valuing and yearning for connection. And this note to ourselves that physical distancing is not emotional distancing. And what you might need right now is connection, like intimate connection. And intimate connection might be not going through the motions of a conversation with a loved one about how was your day, gee, it was so stressful, but what are you most scared of? You know, what are your hopes and dreams for when this is over? There are ways that we can have connection with people that are going to a level of depth, and this is important. Guilt as a parent. Guilt might be a signpost that you value presence and connection with your child, and you are not feeling enough of it right now. And so this allows us to then make those tiny tweaks that I spoke about earlier, which is, I don't have a lot of time in my day, but if I go for a little walk with my little being, that's my connection. Or, you know, so the first thing that I would say is that how do we start moving through our difficult emotions in a way that is healthy? Be compassionate, be open to them, but also be curious about them. What is this emotion signaling to me that I need? If it's exhaustion, it's signaling something that I need. Let me give space for it. So that's the first thing. The second thing that I would describe is that often what happens when we experience difficult emotions is we use very big words, umbrella terms, to describe what it is we're feeling. So we'll say something like, I'm stressed. And everything becomes demarcated by the word stress. But there is a world of difference between stress and disappointment because I'm feeling unseen in my workplace right now. Stress and, gee, maybe I'm in the wrong job. Okay. Stress and I am feeling shattered and I need to reconnect with myself. So what we know is that when we use these very big labels to describe what we're feeling, it's not helpful, because how do you deal with this big thing called stress? It's overwhelming. What I found in my work, in my research, is that when we are more nuanced, when we say, what are two other things that I might be feeling? Oh, it's disappointment. It's lack of connection. What's really going on here is frustration. When we label our emotions more accurately, what in the psychological literature is called emotion granularity, what it does is it actually enables us to understand the cause of the emotion more accurately, and then to put in place concrete steps. And then last, and then maybe we can ask a couple of audience questions, is be careful of this language. I am stressed. I am sad. I am being undermined. When we say things like I am, what you can hear linguistically is that you are defining yourself by the emotion. I am sad. All of me, 100% of me is sad. There's no space for anything else. But you aren't your emotion. You know, your emotion is a data source. Our emotions are data, but they're not directives. We don't have to listen to our emotions and be directed by our emotions. So our emotions are a data source, but they're not who we are as people. So it's very powerful, but important linguistically to not define yourself by your emotion. So instead of saying, I am stressed, I'm noticing that I'm feeling stressed. I am undermined. I'm noticing that I'm feeling that I'm being undermined. I am not good enough. Okay, which a lot of people are experiencing right now in healthcare. Like, I'm not good enough. Like, I can't I'm noticing that this is my story, that I am not good enough, or I'm noticing that this is my thought, that I'm not good enough. What we do here is it's a kind of a mindfulness strategy where we're noticing our thoughts, our emotions, and our stories for what they are. They are thoughts, they are emotions, they are stories, they are facts. And so what you're doing here is you're starting to create linguistic space. And there's this beautiful metaphor that I sometimes use in my work to describe what this feels like, which is when we feel consumed by an emotion, when we are, I am sad, I am stressed, it's almost as if you imagine, again, using the weather metaphor that we used earlier, which is that the emotion is a cloud and you are the cloud. I am the cloud of sad. I am the cloud of stress. But for everyone on this call today, for everyone listening, you are not the cloud. You are not the cloud. You are the sky. You are the sky. You are, every one of you, big, capacious, human, complex enough to have many different emotions, to have values and intentions and courage and wisdom and friends and support and so much more that you can draw on. And when we start using these kind of strategies, we're pulling back from I am sad into I'm noticing that I'm feeling sad. What you're doing is you're starting to become the sky. I would just end there, and then we can maybe, have a couple of questions. But I just wanted to, I've been talking a lot in this call, I think partly because of the subject matter, but also because I mentioned that on Saturday was the anniversary of my father's death, and it also happened to be the birthday of my daughter. Because, what we have in that is what all of us know, which is that life's beauty is inseparable from its fragility. That we are, all of us, needed until redundant. We are in relationships that are healthy until for some reason that relationship is not healthy anymore. We are healthy as individuals until illness brings us to our knees. The only certainty is uncertainty. The only certainty is uncertainty. And so these emotional agility skills are skills that are critical to helping us to deal with the world as it is, not as we wish it to be. And when I was little, 10 years before my father was diagnosed with cancer, before any of us knew that he was going to die, I was about 5 years old. And at around 5, children become aware of their own mortality. And I remember going into my father's and mother's bed every single night. I would climb into their bed after they had spent an hour putting me to sleep in mine. And I would say to them, I'm scared you're going to die one day. Because this is normal. Psychologically, children become aware of this. And I would say to them, I'm scared you're going to die one day. I'm scared you're going to die. And it would have been so easy for my father to say, no, I'm going to be around for much longer. Don't worry about that now. It would have been so easy for him to do that. But he didn't. He didn't. What he did is he comforted me with soft pats, with kisses. And what he said to me is this. He said, we all die, Susan. It's normal to be scared. We all die. It's normal to be scared. And what I understood about the way that he was guiding me through those nights is he was effectively saying to me, courage for me, and I would extend that to saying courage for all of us. Courage for all of us is not an absence of fear or grief or anxiety or any other experience. Courage is about feeling your emotions with compassion and curiosity, and then taking the next step in a way that feels values concordant. Because burnout is what happens when we are just going through the motions. Regeneration is what happens when we connect with our intrinsic values, Why am I doing this? Who is the me in the being rather than the me in the doing? What are my values here? And when we as people in healthcare are more connecting with why am I doing what I'm doing? I value fairness, I value equity, I value collaboration, I value seeing the other. Courage is not the absence of fear. Courage is about being able to recognize our emotions with curiosity, with compassion, and then take values connected steps in moving forward in the world. And so, what I talk about in my TED is this idea that courage is not the absence of fear. Courage is fear walking. It's moving forward with our values. So in close, I would just say I think all of us are being asked right now to be agile. All of us are. And in South Africa, there's this beautiful phrase, which is sawubona. It means hello in Zulu, but it really means I see you. And by seeing you, I bring you into being. And now is the time to see ourselves, because it's only in seeing ourselves that we are more effectively able to see others too. And this, I believe, is the way forward in this fragile, beautiful world that we are in right now.
Thank you so much, Susan. There's so much wisdom in what you just said. It's really impossible to summarize it, but the whole notion of just taking that pause, finding ways to become more literate in our vocabulary about emotions and recognizing that they do not comprise us.
Yes.
They are one aspect of what we can feel and experience, and then being able to set that in some place with respect and yet walk through that in a way that still supports our sense of purpose and meaning is how we get to that, perhaps one way of making our way to the top of the pyramid in your graphic. Let me pose some of these questions. We've had a lot of really terrific questions. We just have a couple of minutes left, but I have seen some, they're just pretty incredible. One person was, I just want to find this one. This one person was asking about disenfranchised grief, that the hospital had planned an event for the 5th anniversary of the Mother Emanuel massacre. The pandemic interfered with it, and the massacre was a racial issue. I feel compounded grief. How do I become emotionally agile with so many levels of complex emotions and grief? It's an interesting and difficult question.
It's a really important question. The first I think that's really important is to name it, is to name those different emotions. And it sounds like the kinds of emotions that are in there are kind of a sense of injustice, of there's grief, there's so much going on there. One of the most powerful ways we as human beings can work through difficult experiences is actually been found in journaling. So what's really interesting is what happens when we journal is you can kind of just journal from the perspective of venting, I'm just getting it all out. And that's less effective than what I'm going to describe now, which is if you just kind of set yourself a little bit of time, it can be even 5 minutes, and just writing down, what is it that you're experiencing, but in a very demarcated way. So it's 5 minutes or 10 minutes as opposed to spending, 3 hours doing it. What I experienced with this teacher was that when she invited us to do this, over time I started to, I was definitely using some supposedly negative emotion words, but over time I also started to kind of reconnect with my a sense of what is described as being insight. So it's this idea that you didn't invite the circumstance. No one invited the circumstance on themselves, but we all learning things about ourselves. And I think, from that question, like what I just wanted to say is, there's very little change that's ever happened in the world without anger. There's very little change that's ever happened in the world without showing up to what it is we are feeling as people. And then if we hooked, we're using our anger to lash out. But when we are agile, what we are doing is we're saying, what is my anger signaling to me is important? And what actions can I take to bring these values forward in my world? So for that particular question, what those actions are is going to be different from what they might be for someone else. But I would really encourage, to show up to those emotions, to label them, to describe them, and to see what insight you get from them, because that anger mixed with grief is often shining a light on your purpose. And that is profound, and that is important, and there's power in holding that and learning the contours of that.
Thank you so much. I'm glad you addressed this issue of anger also, because that was also among the many questions. We are a little bit over time, and I'm afraid we're going to have to wrap up. There's so many more questions to address, and I hope that people are able to glean some insights into what they're posing here in these questions by listening to you and replaying the webinar if they wish. But for now, I want to just thank you, Susan, so much for sharing your time with us. And I'll turn this back over to our moderator, Stephanie.
Thank you. Thank you for having me.
Thank you.
Yeah, thank you so much to Beth, and thank you, Dr. David. This was a phenomenal session, and there's so much gratitude and appreciation in our comments. So thank you, everyone, for sharing your thoughts. We're so glad you were able to join us today. We will be sending you a link to the recording of the webinar, which will be posted on our website as soon as it's possible to post it. I think it'll be tomorrow morning, but we'll send you a link in case you'd like to share it. And in the meantime, we just want to invite you all to join us. We'll be launching our another series of events in the form of a virtual conference, our Compassion in Action Conference, which is typically in person and one day will be again. But in the meantime, we hope you'll explore our program and consider joining us starting next month for that. And until then, we know you're busy. We're so grateful you took time to be with us here today. And we hope you all stay well and keep doing the phenomenal work you're doing. And take care. Bye-bye.
Thank you.
Thank you.